Hi everyone. So today's topic is about the regulations of the cardiac heart rate, and you all know that heart doesn't beat the same all the time. It usually speeds up when you run and slows down when you sleep. So let's try to understand how does the body actually decide this. So as you all know, the normal heart rate is 70 to 80 per minute. The first one is the neural regulation. As you all know, there is a parasympathetic and the sympathetic. So parasympathetic, via the help of the vagus nerve, it supplies to SA node, AV node and atria. With this, it usually decreases the heart rate. And how it does, as you know, the vagus nerve releases the acetylcholine and acts on the P cells and causes the hypopolarization of the P cells and decreases. As the same opposite way, sympathetic nerve, as you all know, norepinephrine, noradrenaline acts on the beta cells. It generates the cyclic AMP and acts on the P cells and increases the heart rate. This is the one type of regulation which does in your body, and the other one that we are going to talk is about the reflexes. As you all know, there are baroreceptors and chemoreceptors. So let's focus on the baroreceptors now. So for the first one is located at the aortic arch, as you all know, and the carotid sinus. This one is basically located at the bifurcation of carotid arteries. So it usually goes to the medulla, and with there it usually increases or decreases the blood pressure. So how does it convey the message to the medulla? Let's see it. So first, from aortic arch via vagus nerve, it goes to the medulla, and the carotid sinus, it goes via glossopharyngeal nerve to medulla. So let's see an example. How does it work? If a person has an hypotension, usually it decreases the arterial pressure and decreases the stretch, and with this it decreases the efferent firing. So what happens is it's going to increase the efferent sympathetic firing, and simultaneously it's going to decrease the efferent parasympathetic firing, and it usually increases your heart rate, blood pressure and contractility, and vice versa. You can also see if a patient has an hypertension, it usually increases the atrial pressure and it increases the stretching and it increases the efferent firing. With that, it's going to decrease the efferent sympathetic firing and increase the efferent parasympathetic firing, and it usually going to decrease the heart rate and blood pressure and contractility. And so let's focus on the higher centers. So let's see first from hypothalamus. So hypothalamus, it has an anterior and the posterior part. From the anterior, it goes to the cardiovagal center. With that, it's going to decrease the heart rate. It's going to inhibit the heart rate, the center. And the other one is vasomotor center. It's going to act by a sympathetic, and it's going to increase the heart rate. So this vasomotor center and the cardiogenic centers are the medullary centers that we were talking about here. Okay, so it goes via this, and it usually regulates based on the function what to do when it's going to increase the heart rate and decrease the heart rate and do all the other stuff. And the last but one is the hormonals. So as you know, adrenaline, it increases the heart rate, norepinephrine increases the heart rate, and thyroxine, which is nothing but your thyroid hormones, if it's hypo, it decreases your heart rate, and if it's hyper, it increases the heart rate. And the another regulation we have is a chemical, which is hypoxia, hypercapnia and acidosis, which decreases the heart rate. So these are the basic regulations that we usually look it into the cardiac. And if you want to know specifically about the receptor acting, specifically the beta receptors or cyclic AMP function or the acetylcholine which acts on the P cells and everything, if you want to know, just mention in the comments. And if you are interested to learn more in detail about any specific topic, please mention in the comments, and I'll be very happy to make it available for you. And please like and follow my channel, and hope I'll be looking forward to more this kind of an explanations and related to medical. Thank you.